The name of our session is When a Pill is Not Enough, Medical Device Options. African Americans experience high incidence and poor rates of health outcomes for many chronic health conditions, including cardiac heart disease. Because of this, sometimes traditional treatment methods just aren't enough. Luckily, there are medical device options that may work for you. What we know for sure is that medical device options are not used to the degree that they should be. And from what we know, the results in using medical devices have been very impressive. Today, you will learn more about medical devices, and you can make an informed decision and have a conversation with your doctor. So I am pleased to have Dr. Maria Gordon, Dr. Brad Sutton, and Dr. Paul Underwood. Dr. Underwood will moderate this session, and he's a longtime friend, and I know he's going to do a wonderful job. Thank you, Dr. Underwood, and I'm turning this over to you.
Great. Well, thank you very, very much, Rosalind. I'm Dr. Paul Underwood from Boston Scientific, and today I'm joined with two of my colleagues from the cardiology division, Dr. Maria Gordon and Dr. Brad Sutton. For those of you who may not know, Boston Scientific is a global manufacturer and distributor of minimally invasive, innovative medical devices that transform people's lives through modern technology. Our focus today is on cardiology, but our company also makes devices in other fields, such as spinal cord stimulation for chronic pain, have deep brain stimulation for Parkinson's disease, endoscopy equipment, penile implants. But certainly cardiovascular disease has had a devastating impact on the African-American community. And what I'd like to do today is to just get a chance to help you learn better how we are involved in what we see from our perspective of medical doctors and working with patients who have advanced problems that can often require device-type therapy. Our global headquarters is right outside of Boston, but our cardiology division is situated in the Twin Cities of Minneapolis-St. Paul. Before we begin, I'd like to just give a round of introductions, and I can start. I'm from Knoxville, Tennessee. I did my undergrad at Morehouse College, medical school at Mayo, and then cardiology training at Cleveland Clinic. I practiced in the Phoenix area of interventional cardiology, which is basically putting stents in people who have clogged arteries. I joined Boston Scientific around 10 years ago, and I performed a lot of clinical research, both in private practice and now with Boston Scientific as well. It's very sad to see people who have blockages that can be opened and that are they don't get therapy because they're not referred or they don't reach the hospital fast enough. And so that's really a large part of our focus that we'll have for today. I'd now like to turn it over to Dr. Gordon and have her introduce herself.
Hello, everyone. Thank you, Paul. I am Maria Gordon. I am originally from Venezuela. I was trained as an internist, a cardiologist, and then a cardiac electrophysiologist in Sao Paulo, Brazil. And that specialty is the one who implants, what I did in my clinical practice was to implant pacemakers, defibrillators, and then perform ablations. That is when you go and burn the origin of an arrhythmia. There are many of those. I did that for 9 years before joining Boston Scientific. That was 5 years ago. And I'm currently responsible for the medical oversight of our clinical studies and also our devices that are in the field right now for all of those, the defibrillators, the pacemakers, and then also the electrophysiology devices. What I'm here to help you understand is, how do you have access to those? What questions should you ask and what are the options? So thank you, Paul. Brad, because you're next.
Yeah, thanks, guys. So first of all, thanks to everybody who's on the line and tuning in here. It's a really important topic and close to our hearts. I'm Brad Sutton. I live in Louisville, Kentucky. I did my medical training at Johns Hopkins and then joined the University of Louisville as faculty, where I was on faculty for about 10 years. I'm also a heart rhythm specialist like Maria, so cardiac electrophysiologist. What I think is really important, so I just want to draw on some personal experiences through the course of the discussion, and just remembering back to patients I've taken care of and some of the hesitancy and some of the really insightful questions they would ask about device implantation in particular. A pacemaker, defibrillator, those are devices, stents as well, that go in forever and can be scary. And frankly, understanding why you might be a candidate for one or another is critical. And understanding what the pros and cons are critical. And I think just getting a general sense of familiarity with medical devices, cardiovascular devices in particular, is what we want to do today. So thanks, everybody.
Great. Well, thank you, definitely. And what we want to do is just to perhaps just give an update on what are some of the most important advances that you've seen in your field and what people should be aware of. I can speak for myself. I know that starting as a cardiologist, I was putting in stents in coronary arteries. A stent is something that has a spring. It looks like a spring of a ballpoint pen. It's relatively small. Now we're actually able to replace heart valves. So something that's about this big can be replaced through the leg. And so to me, that's a major advance, and we're still making further advances. So the problem that I see is that oftentimes people don't know that this technology exists, and that people are often older when they need a heart valve replaced, and they may think that the only way to have it is a traditional way of open heart surgery. So they're not even aware that this technology is available for them to help keep them alive. And just going around the room again, what about you, Brad?
Well, so I was just thinking about this morning. You know, there's a range of cardiovascular devices out there and reasons you might need one or another. In my world, on one end of the spectrum, we treated patients who had a cardiac arrest or sudden cardiac death, and that's a very dramatic situation. And those patients would often get a defibrillator to prevent another cardiac arrest. That's an easier conversation, although a very dramatic situation, to say, we don't want you to die, you should get this device. On the other end of the spectrum, and I work very closely with a device called the Watchman Device, is a medical implant for prevention of a problem that you've never had yet. And so one example would be patients who have atrial fibrillation, which is an irregular rhythm in the top chamber of your heart. It's the most common arrhythmia in the world. Those patients are at increased risk of stroke as a result of that rhythm. And in some cases qualify for this device, which is a plug that goes inside the heart and helps significantly reduce the risk of stroke. It also allows you to come off blood thinners, which are typically used to prevent stroke in the setting of atrial fibrillation. So the conversation around you might need a device or might be a good candidate for a device for a disease that you haven't had, a stroke you haven't had necessarily, or for something that you're not currently feeling symptoms from. You're not having pain, you're not feeling badly necessarily. That's a very different kind of conversation, and I think takes a little more patience and a little more discussion typically with patients.
Great, thank you. I learn something new all the time. And then for you, Dr. Gordon, what are some of the advances that you've seen in your field?
Yeah, well, at being the same field as Brad, I think, as you mentioned, there are defibrillators is one that, even though is very old in the field and has been now for many, many years with us, still not as well known for events when the sudden death hasn't already happened, right? I mean, as Brad mentioned before, you could have the tragic event where the patient had a sudden death. That means the heart stopped beating, was recovered, made it to the hospital, and then was implanted with a defibrillator. But then there are patients who could have conditions like heart failure, an enlarged heart, and they haven't had this type of events yet. They are on medication, but they might be indicated for a defibrillator. So that's something to consider. And one, I would say, innovation that to me is very important to know is a subcutaneous defibrillator. That's unique to Boston Scientific, but I mention it just because for many young patients who don't, the difference between I'm going to start with that, from a subcutaneous defibrillator to a traditional defibrillator, is that it doesn't need to have any permanent leads in the heart. It's completely out of the body, meaning under the skin, on the chest. And then that's a big difference for patients who are going to live with these devices for years or forever. So having that as an option is also important to know for patients who don't have good vascular access, where the veins perhaps are not as easy to get through to the heart as you do in a traditional defibrillator. So it's one more option that is important for patients who might need a defibrillator to know that is available.
Great. Very, very good. Thank you. And now, can you just describe how these devices can help improve patients' lives and some of the challenges that you may have faced when you've been dealing with patients who perhaps that may perhaps be candidates for these therapies?
Well, as we have said so far, I mean, you could have different reasons for having a device implanted, and with the defibrillators, it's pretty straightforward. I mean, it's going to be like a guardian angel there in the heart that is going to just go off when you need it. And otherwise, if you didn't have it on, you're probably just going to experience a tragic event like a sudden death, which you could be recovered from or not. Likely not if you are out of the hospital environment, which is the most common. Now, the fact that you have that is pretty clear. Now, when it's about pacemakers or devices that are going to just be also go off when you need it, your heart rate can be low, which can make you feel tired or decrease your tolerance to exercise, and also make you experience some symptoms like lightheadedness or dizziness. If you have a pacemaker because of those reasons when you need it, it's also going to improve your ability to live a normal life. And I always told that to my patients, that patients are always scared of getting anything implanted. It looks like it's not a big surgery, but it's not so much about the surgery. It's more about the fact that they are going to live with that forever. So it's not about the 30 minutes, an hour, or whatever the time might be that it takes to implant the device. It's just a lifetime of living with it. And it's important for the patient to understand what you're asking, meaning what's the benefit of having it, but also what does it look like to live with it. So I always told them, this is being implanted for you to have a better life, for you to have more quality of life. Of course, it's also with the understanding that a person who has a device implanted is not the same type of life of a person who doesn't have it implanted. But for sure, it's going to make their life better by enabling them to have a normal life, to be able to be with their families, to run after their children, to do whatever sport they used to do within reason, because that is where the questions to your doctor become the most important, to understand what is that you can do and what is that you shouldn't do while living with the device. Brad, what yeah.
Well, something you said, Maria, I think really resonated with me. And I think about, you can have a conversation in the office with a patient. I can show them a pacemaker. You can show them a stent or a valve, and they get a general sense. And there are YouTube videos with nice animations of these things. But talking to somebody who's had the procedure or the device, is living with the device, can be really useful too. And there are patient groups where you can connect with folks who have similar kind of disease conditions that you might and have undergone the procedure. And very often it's reassuring to connect with somebody who's had the procedure, who feels better, who could sort of explain what their hospital stay was, what their course looked like, around the time of the procedure. And so I would encourage you to do that as well. And if you have difficulty finding connections, your physician can often help you connect with somebody in their practice who would be willing to talk to you.
Yeah, absolutely. I think one of the things that we've noticed is that, again, it's not knowing, people not knowing that the technologies exist, and then not working with their primary care physicians or their doctors to actually be referred to someone that can give them more information on the products. So they tend to be managed with medicines, and not saying that there's anything wrong with having medicines and medical management, but on occasion, as time progresses and the disease progresses, then it may be that the medicines are no longer as effective or perform as well as they did in the past. And the devices that we have are really geared toward being the safety net for a lot of patients who have gone past the point of medical therapy. And so to make the referrals is very important, but if the primary care physician isn't aware of the therapy or really linked with people who actually know about the technology, such as the transcatheter aortic valves, then sometimes that linkage isn't made. And then there's oftentimes going to another doctor brings stress on people because you'll have to, make an appointment, initial appointment, go through insurances, perhaps travel to areas that you're not used to traveling to. And so patients may not really feel the need to follow up as closely either. And that certainly puts them in jeopardy because then they just deny themselves the opportunity for the life-saving measures that could have been made for them. So I think it's important to educate people on what's available for them, in terms of their condition, what are the current guidelines, what's the state-of-the-art treatment for those conditions, and to make sure that they actually receive them, both in terms of their activity levels and their medications. And then on occasion, when their condition progresses, are there perhaps devices or other operations that the patients may benefit from?
Paul, as I look through kind of the chat here and listen to you, there's just some general questions about fear of going to the doctor, or how do you know when pill isn't enough? And the things that come to my mind, I'd be interested in your thoughts. One, you have to trust your physician, right? You have to have a relationship with your physician. And it's okay to shop around, because I'm just going to be honest, doctors are not all created equal. And if you don't feel like you're getting good communication, good education about your disease state, if you can't list what your medical problems are, or at least the top one or two, then that's very often a failure on their part. And so you don't have to stick with bad doctors, number one, or they might be good doctors who just don't communicate well. And then I think the second thing is you have to be an advocate for yourself, right? You have to ask tough questions, and it's okay to say, I'm not quite sure. I want to think about it. I want to do a little more research, and ask for them to point you in directions where you can go to trusted sources on the internet, because some are trustworthy, some are not. So that education piece, that communication piece is really critical.
Yeah, and that's a good point. And I was thinking, again, when we were preparing for this, that and you need to know your condition by name. I think that's one of the first steps to move forward, to get the best treatment possible. I remember having patients where they couldn't tell what they were there for. And what is that? I mean, they knew they had a problem. They knew they needed a cardiologist, but that was as much as they knew. So it is important to know exactly what is that you have. Because, for example, if you have atrial fibrillation, that might be what Dr. Sutton was mentioning before about having devices that could prevent or more issues like stroke. And then you need to know what it is, right? Or you could have an enlarged heart for different reasons. Is that because you had a heart attack and now you need probably one of the stents that Paul mentioned before? And furthermore, after the stent, you might or you might not need a defibrillator, depending on the size of your heart. So you need to know the name of that condition. And you could be an elderly person who probably is not going to go, I can tell from my grandfathers that they are not going to probably go online to do research and know what the trustworthy source is. But you can ask a relative to help you. And if you don't have a relative, you can have a good friend to help you. So, and also be prepared for the appointments and go with a list of questions and ask the doctor, what is that I have? What is the name of what I have? And probably you haven't gotten that after a few doctors, and you need to get that clear to know what the next step is. And as Dr. Underwood mentioned before, you could have the need for medication, but is that it? And it might be it. But you need to ask, is this all that is out there for me? Are there devices that I'm eligible for? Are there procedures? I mentioned the ablations at the beginning that could heal me from this arrhythmia, and I could probably not need the medication anymore. That's very different per patient. It depends on your condition that is unique to you. So then you need to have all the facts. And if you don't feel comfortable, you need to ask for help from someone you trust to help you be well prepared for that appointment so you can make the right decisions. So
I wholeheartedly agree. And I think that what we're saying is that in the past, perhaps you would go to the doctor and the doctor would do something to you and then you would go back home. Now it's very important that the person knows what their condition is and what the expected outcomes are and what the goals of therapy are. So if you have high blood pressure, then someone should tell you, you should know very clearly what range your blood pressure should be in. And you can also monitor your blood pressure at home. If your blood pressure is not in the right range, you go to the doctor and ask, what can we do to get down the right range? You have to know your condition very clearly and then work with your physicians. And if you find physicians or healthcare practitioners that you don't jive with, that don't seem to be giving you the answers or communicating with you the way that you would like to, it's really imperative that you do find someone that can be your advocate in health. And I think it's very important to align on goals, knowing what you need to do and knowing what the physician needs to do in terms of what our outcomes are, such as with Dr. Sutton's group. The outcomes would be perhaps not to have a stroke and to not have problems with bleeding. And so if we're clear that those are the desires, then we can move forward and do things. And similar to mine with the valves or with the stents, we want people to have their arteries open. So people will still need to take medicines. They'll need to exercise. They'll need to stay away from cigarettes. But if they do develop symptoms, they need to come back and we'll need to look again to see if there's something that we should open. So it's a back and forth relationship, and you really have to have good communication and know how to navigate the healthcare system. And I know that that's definitely challenging for people depending on which system you're in, but you can find people either in your family or friends within your church, they're community health advocates, or even speaking with other doctors or friends of doctors or nurses that may be able to help guide you through the process and help formulate your questions so that you'll have a distinct list when you go into your healthcare practitioner to make sure that you get the answers that you need to make your life better. I think these are all extremely important topics. And I think that from our standpoint, seeing the devastating impact that heart disease can have on people, we really want you to know that there's a lot that has happened over the past years. It's hard for anyone to keep up with all of it. But if you're a patient and you're afflicted with some of these problems, you'll need to know how to understand what you have so that you can go out and advocate for yourself.
Well, do we have a couple minutes to hit some of these questions in the Q&A?
Absolutely.
So maybe I'll just summarize a couple that I saw and maybe to Maria. It's about kind of how pacemakers have evolved. Talk maybe a little bit about battery life and how that's changed over time. And then I think there are some questions that get to remote monitoring and perhaps how the patient interaction, physician interaction has changed. Do you have to worry about microwaves anymore? That kind of stuff.
Yeah, I'm glad you caught those. I was trying to catch the latest. The battery life is a great question. I mean, I think we have seen over time that's a long time. Actually, nowadays, I mean, the pacemakers, they are, let's say, manufactured to last any time between, let's say, 8 years is the average, but we see them lasting even 12, 14 years. Actually, when I was in practice, I remember some pacemakers that even the devices that you used to interrogate them didn't work anymore because they were so old and they had lasted so long. So that has improved significantly. And actually, one of the technologies that Boston Scientific has is called EnduraLife, and that means simply that we have developed batteries to last for a long time. So the need of changing the battery out is not as often as it was in the past. And then regarding the remote monitoring, we have devices, and it's not only Boston Scientific. Basically, every manufacturer out there of implantable devices like pacemakers have monitors that you can have by your bedside that are going to keep communicating with your pacemaker, with your defibrillator, and are going to send that information to your physician, your care team, your nurses, to make sure that they know the health of your device. And in the case that there is an issue with it, it's going to be communicated or flagged to your care team right away. So that's very reassuring. First, because you know you received the device and probably you have at least 10, 12 years not to worry about the battery. And for the constant care of your device, it's not like before that you had to go and get the device checked in the office was the only option. These days, even with COVID, we saw it, right? Many patients couldn't go to the hospital unless there was an emergent need for it, and they were monitored this way remotely. And also the question about the microwave, that's a good one. And it is when patients are implanted with a device, sometimes they are given a book and it's read it. I mean, here are the precautions you should follow, because we shouldn't do that with physicians or nurses, right? I mean, we should take the time to go over the details, and even people from the manufacturer. But there is a lot that has changed, and things are not, the microwave comment comes from before because people were afraid, or patients were afraid of turning on any basic electronic after being implanted. But there is a lot of safeguards now for that not to be the case. You just need to be informed, ask the right questions, and not to assume that what the neighbor told you is going to be the case for you. It's just to understand what is that you can do, because there are some risks that you need to be aware of, but those are very rare, and there is a lot of information out there. Brad, do you want to comment? We have like 3 more minutes. I don't know, but probably a little bit more about Watchman. I think that's one of probably not the device itself, but what does it mean to live with atrial fibrillation if it's the most common arrhythmia out there? And this, besides all the issues that it causes for the heart, and one of the main problems is the potential of stroke, which can really create a significant impact in quality of life. So what does it mean to have that device implanted and it's like you don't need medication anymore? What are your comments on that?
No, that's a great question. So the Watchman device, again, is implanted into the top left side of your heart, and it plugs up an area where a lot of blood clots can form. And if those blood clots break off and go to the brain, that's how that condition causes stroke. And so what the Watchman device allows you to do is typically those strokes are prevented with a blood thinner. So a blood thinning pill you take every day. The Watchman device allows you to get off that blood thinner, essentially. So very often useful for folks who have trouble with bleeding or trouble with just taking the medication or just don't want to take the medication for lifestyle reasons. So it's a nice alternative for people looking for an alternative to long-term blood thinners for stroke prevention. The Watchman device is a good thing to consider.
Fantastic. I see a question in here about someone asked about the left ventricular assist devices and defibrillators, which is interesting because the left ventricular assist device, or kind of like artificial hearts, have really progressed quite a bit, over time. And what we're doing now is finding purpose-built devices, some of them for people who may end up with a transplant, or some people who may actually decide that they don't want a transplant, but to have the device. And so, as Dr. Gordon said, the battery life, the durability, and the function of the machines is very, very important. And also the access to make them smaller so that they're available for perhaps smaller people, but also to make them easier to implant and easier to use and function better. So there are advances in the ventricular assist devices, or the artificial heart type devices as well. And we've been working actively with them to make improvements on those, just as some of our other devices. And the innovative devices, as we just mentioned with Dr. Sutton and Watchman, left atrial appendage occlusion, this is a novel way to try to prevent strokes and help make sure that stroke prevention strategies are available to all people, not just people who may be able to tolerate blood thinners. And so this is a remarkable advance that we want to make sure that people are very well aware of, and to not have problems with succumbing to something needlessly that was certainly a major problem from the past. It looks like our time is running short. And what I can do is to say that if you put your questions in the Q&A box, what we'll be able to do is to answer them, and then we'll be able to have them in our booth that we have in our exhibit hall. And so the booth that Boston Scientific has is called Close the Gap. Close the Gap is a health equity initiative that Boston Scientific has had for the past 16 years. It was started because we realized that people who were at highest risk, so African Americans and women, were having fatal heart disease, so sudden cardiac death, were not getting devices, defibrillators, as they should. So Close the Gap over the past 16 years has worked with doctors, worked with patients, healthcare systems, and insurance payers to make sure that people are aware and do what they can to know their risks and to be able to seek help and optimize their medical care. And so with that, I think we should end the discussion here. And thank you for joining us. And please enjoy the rest of the summit and visit us in the exhibit hall. But first, before we go, Maria, I'd like to ask you if you could just do a quick translation for me. And how would you say Black health matters in Spanish?
La salud de las personas negras es importante.
Very good. Thank you very much. Gracias.
That's a little too long, but that's fine. Thank you.
No, it's very good.
With you today.
Thank you all.
Bye.
Goodbye.
Bye.